Nationwide Children's Hospital is one of the largest pediatric trauma centers in the country, and it provides a huge service to our referral area and to the children in the state of Ohio. Being a level 1 institution requires an enormous commitment within an institution. We take that business very seriously because ultimately the goal is to save lives and to get children back into their home environment in the healthiest manner that we can do that, and we do that well.
Kylie and I were in a car accident. She was unconscious on scene. They brought her to Children's. They took her into surgery immediately. They ended up removing her left side skull. They removed the blood clot off her brain, and she was in ICU in a coma for 4 days.
Having those timely front-end resources to be able to identify when a patient needs OR emergently, we do that well. We practice that. We research that.
We went to the neuro floor, and then after she got to a certain point where they felt rehab would be good for her and she was actually making progress, we went to the rehab floor.
Our objective is to maximize the child's ability to go back into their home environment as they did before their injury. The other is to minimize the effects of trauma.
Whether it was the trauma or the nurses or the neuro floor or the rehab floor, they all worked together, they all communicated. It seemed like they all knew what was going on at the same time and what Kylie's next step was or would be. She's been discharged now for I think 2 or 3 months, just doing really good. I couldn't be any more blessed. I'm so happy with how the outcome came.
I mean, we have a passion here at this institution for trauma. We recognize trauma as a disease, and as such, we practice and we prepare so we can provide those life-saving interventions in a timely fashion and in an expert fashion.